Okay, hi, I'm Lucy Keatley from the Adult Clinic at Westmead. First of all, how many people in the room are transitioning or have somebody that they love that are transitioning? Soon-ish. Okie dokie. So I would say to you, have you moved from a primary school to a high school? Because really moving from children's hospital to adult hospitals is kind of similar. You suss out which school you want to go to, and some of that is about location, some of that is about convenience, some of that is about preconceived ideas, some of that is about what other people say about it. Kind of the same. What do? You go and visit it. You go and check it out to see that your ideas about that school or that hospital is right. Good thing to do. And do that early. Don't leave that to the last minute. You have to fill out lots of forms. This is the time to get your young people filling out forms on your behalf. I've got a 17-year-old and I made him fill out his forms for his Medicare card just the other day. It was hilarious. It took a really, really, really long time. But again, because I'm in this process as well of trying to help my young people be independent in my own house, go and meet the teachers at schools. Often they have open days where you can go and meet people. Same with us. We don't have open days. You can make your own times. You can just come and suss out the hospital without us, or you can give us a tinkle and say, can we come up and have a chat? And get prepared. You know, if you're going to school, you have to wear a different uniform. You have to need new stationery, new books. You've got to go and organise all of that. And it prepares you. The process of doing that prepares you. It's the same thing with coming to an adult hospital. Finding a GP that you like, getting referral letters from them, Medicare cards, healthcare cards, doing all that stuff that's time-consuming and rather painful actually helps the process, because it actually is moving steps forward for change. You work out how to get to school, whether you can get a bus pass or not. Same thing with kids, adult hospitals. Where can I most easily get to clinic? Where can I pick up my medications from? Can I park there? Should I take the train? Think about all of that before you come. Have to talk about the elephant in the room, because these are the questions that are always asked about adult hospitals. It's true, it is 2016, but no, New South Wales Health does not let us share electronic medical files yet. So don't be surprised if when you arrive, we have the pile of pieces of paper that the paediatric hospitals have put together with us with the summary of what it is that they think we should know about you. That's how it is. We're used to it. You need to get used to it. Still surprises me in 2016 that is indeed the case, but it is indeed the case. Rest assured, we will often ring somebody and say, can we have this? Did we do this? Can I have this result? Blah, blah, blah. But most of the time, we can actually survive on the minimal, the information we're given, the salient information that we are given. And of course, on top of that, we have our transition clinic, so we actually have a little bit more information that we've been given, pictures painted for us. We meet young people and their families, and so it's all of that that actually matters. And of course, we like doing our own tests anyway, so it's the same thing all over again, except for just with a different person taking your blood or a different person taking your lung function. No, there are no games rooms. No, it's not much fun at an adult hospital. We don't have footy players visit. We don't have clowns coming to visit you. Yes, you are connected to an IV pole most of the time, and yes, you may have to share a room, and sometimes that is with old men. That is all true. It does happen. We absolutely advocate for you as much as we possibly can. Certainly at Westmead, we have a lot of really experienced nurses on our respiratory wards, and they are very staunch advocates for making sure that people are in single rooms as much as they possibly can be, and they will really go out of their way to ensure that happens where it's possible. And yes, it is hard to get a bed when you need an admission in a timely fashion. So all those things are absolutely true about adult hospitals. What are the practical things you can do? And as I say, the practical things are also, emotionally help you get ready for change. So you need a GP referral, you need to own your own Medicare card, you need a healthcare card that's valid and is going to last you a little while, you need to think about your safety net, and you need to think about access to medications. Next slide. So finding a GP that you like, talk to people who know a GP that they like or that you think they're good, but go and meet them and make up your own mind. It's actually a very important relationship to have. Women are normally better at this than men, but when you see any specialist in an adult hospital, you need a GP referral to be able to see that individual, whether it's an endocrinologist or a gastroenterologist. They can do lots of other things for you that you need. Women need pap smears regularly. GPs are great with immunisations. They can give you your annual flu vax that we recommend. They can write PBS scripts and authority scripts that you can get from your local pharmacy rather than the ones you get from hospital. And there's, GPs do lots of things for us, and they're good people to have a good relationship with them. So choose wisely, but actually find one. Next slide. So yes, this is what I was going to babble on about, that every single referral, every single specialist you ever see in an adult hospital needs a referral. A specialist referral only lasts for 3 months, a GP referral lasts for 12 months, and an indefinite GP referral lasts indefinitely unless they change location or you change GPs, and that's when you would need to get another one. So just be prepared for that, because it's something that needs to happen before you get your first appointment at the adult hospital. So if you haven't got a GP already, go and find one, make sure you like them, and start talking about the fact that you're going to be transitioning from a paediatric centre to an adult centre, and you'll need the relevant GP referrals. Get your own Medicare card. From the age of 15 onwards, you can have your own your own Medicare card. But mothers like me chose to still have my 17-year-old on my Medicare card, but he can have a Medicare card of his own. This just means that if he needs to go to the GP without me now, he can, and I don't have to give him my Medicare card anymore, because in about 10 to 16 weeks he'll get one of his own. You can just get a copy, but what I learned last week is actually the best thing to do is to get a new Medicare card for your young person, but keep them on your own card. It is a strange form. It's got far more pages in it than I think that you probably need, but it is possible for a 17-year-old to fill it in with a bit of prodding. Next. Healthcare cards. Now, as we all know, our government loves just when you've got everything sorted to go, okay, now you're 16, everything changes, you can't do that anymore, your healthcare card gets taken away, and yada, yada, yada. So just be aware of your options. If you are already with a healthcare card, you're a full-time student and you're between the ages of 16 and 25, then you can apply for an ex-carer's allowance. It's this weird thing to call anything at all an ex-carer's allowance, but that's what they call it. And if you fulfill that criteria, that is the healthcare card to apply for. We do use mobility allowances, and we use low income, and they all get regularly assessed, and they all get affected if you go overseas for long periods of time, or you want to do other more exciting things than come to clinics. My advice is, and it might be on the next slide, ask for help. So we have this organisation called Trapeze that are funded probably better than we are in order to help young people transition. So get them to help you. They can help you find a GP in your local area. They can help you fill out forms. They can do all sorts of things. They can try and advise on healthcare cards, although I have to say I find that the CF New South Wales social workers are normally the best people to advise on healthcare cards, and also the social workers within the paediatric hospitals themselves. But these are all things to be thinking about and getting organised, because the last thing you want to do is transfer to an adult hospital and when I say, when does your healthcare card run out, you go, actually next month, Lucy. Safety net cards, everything has rules applied to them. So a dependent child can be on a family safety net card, but you have to be under 16 or a full-time student, under 25, attending school, college or university, whose parent is substantially supporting you financially. That's a mouthful in itself, isn't it? So you need at some point to get your own safety net card, which is a bit of a disadvantage when you're a single agent. It takes you much longer to get up to have spent the amount that you need in order to be able to get your safety net. So, but again, it's just something to be aware of. Just when you think you've got everything sussed, these are all the things that get in your way. We care. we care about your families. We want your families involved. Certainly at Westmead, no parent is ever asked to leave a clinic room environment unless there's really a very clear need for it. We know that each family is different and deals with us and change in different ways, and we know that because we do it all the time. So that's all right with us. We take each family unit as a family unit. But talk to us, communicate. It's the same message as Sharon. Talk to us, let us know how you're feeling, let us know what's hard, let us know what you hate, let us know what you need. And if we don't know, we can't do anything about it, but if we do, then we most certainly will. And that's really it. It's most people, when we ask them, was that as scary as you thought it was, transfer from the pediatric to the adults, they go, no, actually that wasn't as bad as I thought it would be. And that tends to be the general sense of things. But talk to other people. That's what Facebook is for. You'll get the truths from people who've done it already and people who have moved to adult centres, and that's your little bit of research for you. Anyway, that's it.